We are covering personal protective equipment, or PPE, a critical topic for your phlebotomy exam. The exam will test your understanding that a new pair of non-sterile gloves must be worn for every single patient encounter. This is a non-negotiable standard. Exam questions often create scenarios to trick you, such as a quick finger stick on a familiar patient. But the rule is absolute. One patient, one pair of gloves. These gloves must be disposed of properly after the procedure and before touching other surfaces like a computer or doorknob. Now, let's discuss when additional PPE is necessary, as this is a key area for exam questions. For a routine venipuncture, gloves are typically the only PPE required. However, if there's a risk of splashing or splattering of blood or other potentially infectious materials, you must use more protection. This could happen during an arterial puncture or when accessing a central line. In these higher-risk scenarios, a fluid-resistant gown and eye protection, such as goggles or a face shield, are mandatory. A common exam trap is to present a routine blood draw scenario and include a gown and face shield in the answer options. Do not select them unless the situation explicitly indicates a risk of splashing. The most heavily tested concept regarding PPE is the sequence of putting it on, known as donning, and taking it off, called doffing. The exam will frequently provide a jumbled order and ask you to identify the correct sequence or find the error. The correct order for donning PPE is gown first, then a mask, followed by goggles or a face shield, and finally, gloves. The gloves go on last so they can be pulled over the cuffs of the gown, creating a secure seal. Doffing, or removal, is where most contamination errors occur, and the exam focuses heavily on this. The principle is to remove the most contaminated items first. The sequence is gloves first, then goggles or face shield, followed by the gown, and the mask is removed last. To help you remember the removal order, use this mnemonic. Think alphabetically. You remove gloves, then goggles, then the gown, and finally the mask. This alphabetical trick helps keep the sequence straight during a high-pressure exam. The mask is always removed last, preferably outside the patient's room to protect your airway. Let's consider a classic exam question. A phlebotomist is leaving the room of a patient on contact precautions. The question asks for the correct doffing sequence. The incorrect options will show the gown being removed before the gloves, or the mask being removed first, which would contaminate your hands or expose your airway. The correct answer will always follow the sequence of removing the dirtiest items first: gloves, goggles, gown, and then mask. Understanding this principle of moving from most to least contaminated is key to answering these questions correctly. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.